Your blood vessels carry your 4 to 5 liters of blood through the body over and over, delivering oxygen and nutrients to the body's tissues. The blood exerts a force on the muscular walls of the vessels as the heart beats. This force is called your blood pressure. When the heart contracts or has its highest pressure at which the blood is pushed through the vessels, this is called systole. When the heart relaxes or has the lowest pressure at which the blood flows through the vessels, this is called diastole. A typical healthy person has a blood pressure reading of a bit less than a 120/80. There are several things that increase the blood pressure: the thickness of the blood, extra blood, or narrowing vessels. For example, if the blood thickens, the body needs to work harder to push the blood through the vessels, increasing the blood pressure. If we consume a lot of salt, this promotes water retention and increases the circulating fluid, and therefore it increases the blood pressure. Or when we are stressed, the body produces epinephrine or norepinephrine, which constricts blood vessels and raises the blood pressure. When your blood pressure is elevated and stays that way for prolonged periods, it can cause small tears from the extra pressure on the walls of the arteries, which causes a buildup of plaque and then hardens the arterial walls. These obstructions can cause problems like heart attacks or strokes. The typical healthy heart beats about 60 to 80 times per minute, and it is the work done by that beating heart that creates your blood pressure. Let's talk a little about the tool itself. The cuff is the entire length of the material that is able to wrap around the patient's arm. The bladder is the part that inflates, and the bladder width is the distance from the top to the bottom of the cuff. The bulb is the little grenade-like plastic bulb that you squeeze to get air into the bladder cuff. The valve controls air going in and out of the bladder cuff from the bulb. There are two tubes, one from the cuff to the bulb, and the next from the cuff to the sphygmomanometer or pressure valve. There are several sizes of cuff depending on the person that you will be using the equipment on. The proper size of a cuff should have the inflatable part of the blood pressure cuff cover about 40% of the distance around your upper arm. The cuff should cover 80% of the area from your elbow to your shoulder. Be sure that the sphygmomanometer or pressure gauge is working properly, as well as the valve. If your valve is not able to close, it prevents the bladder cuff from inflating to create the tension on the vessels needed to take the blood pressure reading. To take your blood pressure reading, you will start by cleaning your equipment. Be sure to clean the stethoscope, especially if you are not the exclusive user. This protects you from air infections and the patient from transfer of microorganisms. When you position your cuff, ensure that the pressure gauge is visible to you. This ensures that you are readily able to get the necessary information from it. We first use the palpatory method since the Korotkoff sounds can be challenging to hear to prevent misdirection from the presence of an auscultatory gap. An auscultatory gap, which occurs particularly in hypertensive clients, is the temporary disappearance of sound normally heard over the brachial artery when the cuff pressure is high, followed by the reappearance of sound at a lower level. This temporary disappearance of sound occurs in the latter part of phase 1 and phase 2 and may cover a range of 40 millimeters of mercury. To do this, feel for a pulse, brachial, ulnar, or radial, and inflate the cuff to feel when that pulse disappears. Note that value. This is the estimation for the systolic reading, to which you will add 30 millimeters of mercury. This ensures that the bladder is inflated above the level of any possible auscultatory gap. Hold the bulb in your dominant hand with the valve turned upward. This allows you to close the valve by turning it away from you and opening it by turning it toward you. Now we can do the blood pressure as we traditionally see it done. Place the stethoscope on the brachial artery by palpating for it. It is usually found on the inner aspect of the elbow since it comes from the axillary artery at the shoulder and travels down the underside of the arm. Hold a stethoscope in place between your index and middle finger of your non-dominant hand. It doesn't matter if you use the bell or the diaphragm of the stethoscope for this procedure, though it's most commonly seen that the diaphragm is used. Use your dominant hand to close off the valve and inflate to the estimated systolic pressure plus 30 millimeters of mercury. Slowly control the release of air from the bladder by gently turning the valve and allowing the needle to fall approximately 2 millimeters of mercury per second. Listen for the first sound of the pulse and note where that occurred. This is your systolic reading. Then listen for the pulse to stop. This is your diastolic reading. Once you've achieved a systolic and diastolic reading, release the valve so that the bladder cuff can completely deflate.